Have you ever heard the term CTE? I'm sure you have, especially lately, but if you knew what CTE actually is, then you wouldn't associate that with Antonio Brown with so much certainty and emphatically. So I'm going to tell you exactly what CTE is, and don't worry, it's not going to take me that long. CTE stands for chronic traumatic encephalopathy. Yeah, it is a neurodegenerative brain disease that typically affects athletes and also soldiers, since they sustain an astronomical amount of brain trauma because of repeated hits to the head. CTE is progressive and it's a neurodegenerative disease. CTE can also cause Alzheimer's disease because of the head trauma and the brain damage. But unlike Alzheimer's disease, CTE can be prevented, which is why you cannot say with so much certainty that Antonio Brown has CTE, because the only way to determine it is on autopsy. And you certainly cannot get an autopsy walking and talking. Now, CTE is typically diagnosed in the early 20s and 30s. Now, even though you can't be certain that a person has CTE, there are reasonable indications and signs and symptoms where a physician can say these behaviors are emblematic of CTE. Some of the signs and symptoms you might see are loss of impulse control, mood disturbances, behavioral changes with no apparent triggers, moodiness, aggression, depression, and apathy. So things that the person always wanted to do and loved to do, they no longer show any interest in it. So for example, if Antonio Brown started not showing any interest at all in football, that doesn't necessarily mean that he has CTE. However, it is a sign or symptom or behavior you want to take note of. Over time, as CTE progresses, you may see the person have suicidal thoughts or ideations, impaired memory, memory lapses, withdrawal, confusion, inability to concentrate. All these symptoms are very similar to someone who has a progressive type of dementia, which is a brain condition, neurological. Now, I don't know if you all remember the situation with Philip Adams. So Philip was a former NFL player and he killed 6 people. He, after his death, had an autopsy and it was determined that he had CTE. So you see, it's not that simple to just go around saying that Antonio Brown has CTE. It's important to note that although there is not a cure for CTE, there are treatment strategies. We're talking behavior therapy, some medications that are used for progressive types of dementia. And there's also antipsychotic and antidepressants that could possibly help with the signs and symptoms. So it's still important for you to identify those signs and symptoms and behaviors that are emblematic or that could be contributed to CTE. I do hope you found this information helpful. For more videos like this one, please like and subscribe to my channel, and don't forget to click the bell so that way you know when I upload a new video. Until next time.